what inspired me to pursue a career caring for athletes is that I have been an athlete my whole life. I mean, especially in my younger years. I grew up playing a variety of different sports and dance and whatever else. So from there, I went to university, felt a little bit lost, took kinesiology because I liked sports and I liked science, but really didn't know what I wanted to do. I ended up taking a course and through that applied to work with one of the varsity teams at St. FX, and I was placed with the men's hockey team. It was a really incredible experience because they were really high-level athletes, higher than I'd ever played before. So I got a look into a really different side of things. And so through that, I think that's, it wasn't really I hadn't set out to do that. That wasn't my intention when I went to school, but that's where I ended up. And it really inspired me to continue that care for athletes in the future. So from there, after school, I didn't know exactly what I wanted to do, but I had chiropractic care my entire life when I started having injuries when I was 14, 15. So I decided that I would be able to continue my passion for caring with athletes while going to school. So I did my degree in Toronto and then I came back here, and it's been really great to have the opportunity to work at this clinic where we are working with athletes. And so whether that is a young athlete who that is their entire life and their life revolves around that, or whether that is an athlete who plays once a week, I just think that sport is a great way to keep everybody moving, whether it's an individual sport or whether it's a team one, and in whatever shape and form, whether you're a weekend warrior or a competitive athlete. I really love being able to work with people and help you get to those goals. So my mission in providing performance care would be to work with the individual athlete or the person or the weekend warrior, whatever you want to call yourself, to get to what your goal is. So performance is whatever you want it to be. It depends on your sport. It depends on what your goals are. It depends on where you feel your deficiencies are. Do you want to just feel a little bit better and move better? Is there a specific injury that we need to work on? I think it really depends on what you want. And I want to work with you to help you get there. My approach to care would differ because I've taken a couple of extra courses along the way. So I do provide acupuncture as an adjunct to my chiropractic treatment. So I like to have a whole variety of techniques that I can use. So that way, whatever is going to work best for you is what we're going to do. So I am trained in activator release therapy as well as the spinal manipulation therapy. So some people don't love the actual manipulating that you kind of comes to mind when you think about a chiropractor. So I like to have options for that. I like to really work with the patient and find out what you're comfortable with. I want you to be fully educated and know that you have a decision in your care. And then acupuncture is another one that I provide. So it is just another option that can further your recovery or your performance. And so having all the different tools in my basket and finding out, depending on what your goals are, what we can do and what will work best for you. So the specific techniques that I use traditional spinal manipulation therapy, and I would use diversified technique, which doesn't mean much to most people, but it just means that I have been trained in a variety of different techniques in the spinal manipulation. So if we need to adjust your low back, there's a variety of different ways that I can do that, whatever's going to be most comfortable and best for your particular condition. I also use the activator release method. So some people don't enjoy the actual manual release. So we have the activator tools here, and that is a lot more comfortable for some if that's what you choose. I also do a lot of soft tissue techniques, and again, a variety of that depending on what you need. We have the rapid release here too, so different tools in the clinic that are at my disposal, which are really valuable. I also provide acupuncture. So acupuncture as an adjunct to chiropractic therapy, it's important. So for the acupuncture, it is a Western medical acupuncture. So that differs from your traditional Chinese medicine in the way that we will treat the area that is the problem issue. So we're going to work with the muscles, bones, joints. So to tailor my treatment to the specific needs of the person, again, that will depend on what your goals are, what you are comfortable with for treatment. I want you to feel like you are a part of your care here. And that also depends on whether you're coming in for a maintenance health visit or whether you're coming in because you have sustained an injury and you need assistance in rehabbing that and getting back to normal faster. And that is the benefit of chiropractic care, is that I mean, you know that if you sprain your ankle, eventually it will get better, but things that we can do in here, we can help make that go along faster and make it a smoother process and make sure that it heals properly, and so that we hopefully will not re-injure it. And then there's also our maintenance care. And so that is something that is up to the patient as well. You know, if you come in for an initial visit, we can go through everything. We look head to toe. We're going to see how you're moving, what needs to move better, what is moving too much, and tailor a specific treatment plan, and as well as some rehab exercises to that. So, you know, you might come in here and you might be looking for acupuncture, but it might not be what's best for you. So we'll have that conversation and we'll decide together whether that's going to be what you need or not. Even within that, for acupuncture, there's different ways to do it. So I also do electroacupuncture, and within that, there's different ways where we can target tissue healing, whether it's going to be pain modulation and releasing pain, because acupuncture itself releases the body's natural anti-inflammatories and painkillers. So it's a great way for people to have some release from pain and get out and back to doing your rehab. So it's kind of a combination of, might it fix your entire problem? No, but might it get you back to where you can then move better, like feel better, and then move in more pain-free and rehab it better. So that's, you know, the point of all the treatments in here is how can we get you moving at an optimal state so then you can return back to your normal activities and continue doing things that are going to progress that rehab, or whether you're just looking to get a little bit better at your sport, whether you're looking to increase your gains when you're lifting weights, like it's whatever your goal is, and I'll work with you to do that. What I find most rewarding about working with athletes in particular, I think I love how motivated athletes are. They're, you know, a specific breed of people that want to go out there and push themselves and want to get better and do better. And they have, for the most part, very particular goals. You know, like they come in and they know what they want to get from treatment. They know that they want their golf swing to be better, or they know that they want to be able to lift heavier weights, or whatever else it may be. So it can be challenging, and that is also a fun part of it, though. You know, like it's not always going to take, it's not going to be one treatment, and it's going to be a bit of a process. You know, like I want to work with you and get that goal. And if what I'm doing isn't working, then let's find what does work for you. You know, that's why we have a variety of techniques here. That's also why we have multiple practitioners here, because if I'm going to give you everything that I have and everything that I can do and it's not working, then I can consult with somebody else and my colleague here and find out what we can do to make sure that you are getting to the place that you want to be. I think people don't realize sometimes how personally we as chiropractors take your success and your pain. You know, it sucks when you come back in and you're like, well, it still hurts. And I'm like, oh, darn. I'm like, you know, we're trying all these things, and we really want you to feel better. And we want you to succeed. You know, I want you to come back every time and tell me that you feel amazing. And I know that's not going to happen because treatment takes time. And that's something that can be a hard thing to get across to patients sometimes too. You know, when you're working with somebody, you want them to know that I'm here for you, know that I'm caring for you, and know that I want the best for you. But sometimes we're going to try everything and it's not going to work. So then we have to flip it and try something else. But I want to be that person for you, to work with you, and know how much I have to try not to take that home with me at the end of the night has been something I've been trying to learn how to do, because, you know, I'll be thinking about what else can I do and what haven't we tried and what more can I give you to get you to where you want to be, whether it's just that you want to increase your performance or whether you're in a lot of pain. And I mean, the pain ones are harder because people come in and, you know, that's part of the job is I want you to be able to talk to me, and I want you to know that, like, I think one big thing is that people will come in and they feel like they have to almost prove their pain. They're like, listen, like I have a really high pain tolerance and this really hurts. And I want people to know that I'm like, I believe you. Like, I know that your pain is real and that I'm here to listen and I'm here to try to help you in whatever way that I can. So it's sometimes it can be a lot, but at the same time, it can be so rewarding. And I feel proud almost when you come in and you're like, I was able to do this and this was able to be great. And I'm like, oh, that's amazing. Like, that's so awesome. Like, that is what I want. And I mean, you know, success is a journey and there's ups and there's downs and everything happens, but I want to be a part of that and help you along that journey in whatever place you are in life, whether you're in high school or whether you're in your 80s, like there's a place here for everybody as long as you have a goal and I can help you reach it. One of the biggest challenges is when things aren't working the way that we hope to. We have all this research and all these studies and everything that we go off of, and we have our personal experience and the patients that we've worked with and all of this knowledge that we have, and sometimes I give you everything that I have and it doesn't work, and that is challenging and it is hard to it's a good thing, to constantly be challenged and to have to look to find more answers, but it's also hard in that it can be frustrating for the patient. It can be frustrating for me, and I don't want anybody to lose faith in me. So it's definitely a challenge, but I want people to know that I'm trying. I'm doing my best, and that's, we'll both do our best and work as hard as we can and figure out what we can do. So it's just, that would be the biggest challenge. For the future here at Nobility, I think Brian and I both have, we have these big envisions for what we want the clinic to be. We want it to be somewhere where our athletes can come, and really anybody who just wants to further their performance, whether you are a professional athlete or just somebody who plays once a week or once every 2 weeks or whatever it is that you just want to keep doing. So we want to have a spot where people feel comfortable, where they can come in and know that we are going to have you taken care of. Right now we have 2 chiropractors and a massage therapist, but we want to grow that, and in the future we'd like to have a spot where we can also have a gym and where we can have a physiotherapist and naturopaths and nutritionists, and we want to have a whole healthcare team that is there for you, because we want to be part of that team, and we want to, I think that also speaks to, if I can't give you what exactly you need, I want to have the person next door that I can give that to as well. And right now we have people that we can work with and refer you to. And that's another part of coming to see us, is that we will know, okay, if I can't help you and figure this out, okay, I'm going to send you to go and see them. I don't want you to waste your time, waste your money coming to see me if that's not going to be what's best for you. And so eventually we'd love to have that all in one building as well. But we'd love it to just be a place where everybody, you hear Nobility and you know that that's where you want to come, and you know that you're going to be taken care of, and that you're going to be happy and feeling great when you leave here.